welcome to our lesson on multiple sclerosis. This exemplar falls under the concept of immunity. So immunity, just as a reminder, is the body's natural or induced response to infection or its associated conditions. So unfortunately, multiple sclerosis is an autoimmune disorder, meaning the body has recognized something in itself as an enemy and has decided to attack it. So in this case, with multiple sclerosis, the body sees the myelin sheath as a pathogen and it has decided to attack it. So the myelin sheath covers the axon of the neuron. So as the body's attacking it, it breaks down that myelin sheath, and you can almost think of that as like the covering of an electrical cord. So eventually it gets gnawed all the way through, and it could completely sever and possibly kill that neuron. So this involves both the brain and the spinal cord. There are 4 different types of MS. There's the relapsing remitting, which is the most common type. So the person will have periods of remission where they have no symptoms at all, and then during periods of stress or exacerbation, they may have a relapse where they start having a lot of those symptoms associated with MS. But once they go into remission, those symptoms go away. Primary progressive, they don't have those periods of remission. It's just a progressively kind of like going down a hill. It's just progressively getting worse over time. Secondary progressive is less common. That's the one that starts out as relapsing remitting, but then over time, when the damage has become so severe, the person doesn't quite fully recover, so they kind of flip into this progressive, secondary progressive, where it's just progressively getting worse. And then progressive relapsing is arguably the worst to have, because not only are you progressively getting worse, you also have periods of relapse where you have worsening symptoms on top of that progressive, decline in your symptoms. So 4 different types, but the relapsing remitting is the most common one that you will see. So there are a few risk factors. Age, most people are diagnosed between the age of 20 to 50, and you'll find that to be common with most autoimmune disorders. Young adulthood is usually when you start seeing symptoms. Women are 4 times more likely to be diagnosed with this, and Caucasians are twice as likely to be diagnosed than any other ethnicity. There's some emerging evidence now that there is a direct link between the Epstein-Barr virus and MS, so that's something that they're doing a lot of research on right now. It's a pretty exciting field that they're working on, and hopefully if they find that to be the direct link, maybe they can develop a vaccine or something so that they can eradicate this disease process. But for now, just recognize that these are the most common risk factors for MS. A lot of symptoms associated with MS, and all of these have to do with your neurologic system. If you think about losing those axons, those neurons dying, then a lot of these symptoms make sense. The numbness, the weakness, the loss of muscle control, even paralysis over time, that nerve pain. And then fatigue is the most common symptom you'll see with any autoimmune disorder. Here's a little picture that came straight from your book. This gentleman is having all of the symptoms around him. And then also keep in mind the mental changes that can happen. So memory loss, trouble with concentration, depression, unstable mood. We have, just periods of being very unhappy and then very happy. It's because of that loss of that myelin sheath, so those neurons are dying. And it can even progress then to loss of bowel and bladder control later on in the stages. So diagnosis, there's a few things we do. Of course, the initial thing would be the neurological exam when we're looking at the weakness, the spasms. The lab test will be pretty benign. There's not anything really that directly points to MS on a laboratory test, but we may do that to rule out a lot of other things. So usually the CBC, the chemistries look good, whereas with some other autoimmune disorders, those will not be good. So that's one way we can differentiate this from other autoimmune disorders. Lumbar puncture could also rule out some other things. Could rule out Lyme's disease, for example, or anything else like meningitis, anything else that could cause those neurological symptoms. Really, our true diagnostic test is going to be the MRI, because the MRI will show those multiple sclerosed areas on the brain and the spinal cord. So that is our number one diagnostic test. So lots of treatments here. Our goal is always to get anybody with an autoimmune disorder into remission and to keep them there. So if somebody has, primary progressive or secondary progressive MS, then that might not be possible to get them into full remission. But we, in that case, would try to slow the progression of the disease and to manage the symptoms. So immunomodulators work with the immune system, and immunosuppressants suppress the immune system so it's not attacking that myelin sheath. Both of those drug categories were discussed in modules 1 and 2, so you should go back and look at the templates for those, add to it if you need to. Nothing's changed with those. Muscle relaxers and antispasmodics can also be very helpful, especially if there's bladder involvement. So baclofen is a really common one that we use for that. Corticosteroids, we try not to use if we can help it, but during periods of exacerbation, they are really good for getting that person back into remission. But once they're in remission, we try to get them off the steroids. We don't really want to stay on steroids because of all of the bad side effects that they can have. Anticholinergics and antimuscarinics are really good for if they're having trouble with bowel and bladder. Helps with that bladder control. Anticonvulsants are good for if the person's having seizure activity with this. And then some also help with nerve pain. For example, gabapentin is really good for nerve pain, and that is an anticonvulsant. And if they're having trouble with the bowel elimination, then we may need to put them on laxatives. And we work with a lot of other therapies. When somebody has MS, PT, OT, speech. Speech also works with cognition. Speech therapy always works with anything from the neck up. They help with that, so speech, swallowing, and cognition. And then they may need some mental health resources too because of that mood instability and anxiety and depression. And they may need some vocational help too, as this disease progresses and they have trouble with memory and concentration. It may be difficult to keep the job that they had. Lots of complications too. So MS in itself doesn't shorten life expectancy, that disease process in itself, but there are a lot of complications that can lead to shorter life expectancy, especially the paralysis. So eventually, they maybe have paraplegia or quadriplegia, and that in itself will lead to a lot of its own complications. You've learned since 170 that when you don't move, every body system is affected. So just think about how every body system is affected by just laying in bed. They may have problems with bowel and bladder, incontinence. That leads to its own set of issues. Some sexual dysfunction. Like I said, the mental status changes that can happen. That makes it difficult to hold a career. Depression and seizures. So unfortunately, if this disease progresses and they become quadriplegic, over time they may end up in long-term care just because they're no longer able to care for themselves. So thinking about all those complications, what can you do as a nurse to prevent those complications? And if some of those complications do occur, like quadriplegia, what is your responsibility? So we want to make sure that they still have good range of motion. We want to try to prevent atrophy if we can. Make sure we implement safety precautions. So, get rid of throw rugs. They may need some adaptive equipment like a walker or a cane, crutches, and non-slip footwear, of course. because of that chronic fatigue, you need to teach them what they can do to, make their life easier, like cluster, your care. Maybe the more important things to do in the morning when you have the most amount of energy. Schedule rest periods throughout the day. And then also think about if they lose not just their mobility, but the sensation, all of the complications that can occur from that. So checking water temperatures, they don't have a burn, turning and repositioning, checking their feet, making sure they're wearing good footwear so that there's not an injury that's happening. So you want to try to prevent some of these things from happening. So yeah, make sure you read your book and finish all of your pre-work. So when you come to class, you're ready to discuss this and answer any questions I have. Ask me questions too. I'll see you in class.